Good morning. I would like to particularly thank Dean Rika and Taro and also Miho for inviting me back to this FHS, is it called? FHS International Conference, especially to celebrate the 10th anniversary and also in honor and in memory of Professor Date. It means a lot to me, especially as a good and old friend to Hokkaido University and to Professor Date. In the following 20 minutes, I hope my time was not deducted because of the technical issue. I will still have my 20 minutes, please. In the following 20 minutes, I'm going to introduce and present the result of a three-arm study that is to test two promising interventions to improve the quality of sleep for advanced cancer patients with a three-arm and multi-center randomized control trial. I'm Chia-Chin Lin, the Director of School Nursing at the University of Hong Kong. So the situation of lung cancer that is being the most common and the leading cause of death in many parts of the world, including Hong Kong. In Hong Kong, we have around 4,400 new cases, and among them, the majority of the lung cancer patients, that is 75% of lung cancer patients are diagnosed at late stage, that is stage 3 and 4. And also the lung cancer death accounts for 26% of all cancer death. And for those lung cancer patients, on average, they reported 14 co-occurring symptoms. Among the symptoms, sleep disturbance is one of the most common symptoms reported by lung cancer patients, which impact seriously on their quality of life and their well-being. The sleep disturbance in lung cancer patients, usually this problem is not well recognized and overlooked by healthcare providers. Despite a pharmacological intervention is the most common approach to manage the symptom, however, it usually induces sleep cancer-related fatigue. That is also a serious issue for cancer patients. So it's very important to develop non-pharmacological interventions to manage this serious issue. One of this promising intervention that is aerobic exercise that includes walking, jogging, and also hiking or swimming. And aerobic exercise is a repeat sequence of activities for an extended period of time. It's important. It has the potential to reduce the physiological and psychological effects brought about by cancer and its treatment. And the other promising intervention is called Tai Chi. That is one of the mind-body exercise that is very traditional Chinese exercise. That is a low to moderate intensity mind-body exercise. And usually in Chinese, we believe that practicing Tai Chi can invoke internal functional balance for healing, harmony, stress, neutralization, and longevity. So we thought Tai Chi may have the potential to improve the quality of sleep for lung cancer patients. So the primary objective of this study is to compare the effectiveness of Tai Chi and aerobic exercise on subjective sleep quality. That is the primary outcome. And the secondary objective is to explore changes in some subjective and objective outcome measures, such as objective sleep parameters, psychological distress, fatigue, quality of life, and also circadian rhythm. There are three arms in this study. One arm is aerobic exercise. The patients will receive 1 week supervised exercise plus 3 weeks of home-based exercise, and this will last for 4 months. And the Tai Chi group, they will practice twice a week for 16 weeks. And also this is, we will use 16-form Yang style of Tai Chi exercise. And that include warm-up, standing, meditation, Tai Chi movements, mindfulness, breathing, and relaxation techniques. So this is, the left-hand side is the aerobic exercise. Those are the session of supervised exercise. On the right-hand side is the Tai Chi exercise. This study was conducted during the pandemic, so it's extremely difficult and challenging to run this intervention and the exercise training because oftentimes the whole city of Hong Kong will shut down, and we have to also go very serious or very stringent infection control measures. So this took us a very, very long time to complete this study. The recruitment site includes Queen Mary Hospital, Pamela Nadersol Eastern Hospital, and also Queen Elizabeth Hospital. The inclusion criteria include diagnosed with stage 3B and 4 non-small cell lung cancer patients and age over 18 with current ECOG performance status of 0 to 2 and report not doing regular exercise and also is conscious, clear, and alert. The outcome measures include the subjective sleep quality, which is the primary outcome, and also objective sleep parameters, fatigue, psychological distress, quality of life, and physical functioning include agility measured by time up and go test, strength measured by sit and stand test, and balance measured by one leg balance test. And the secondary outcomes also include cardiopulmonary fitness, level of physical activity, circadian rhythm, and also 1 year survival rate. The analysis includes intention to treat analysis that is at the 1 year follow-up point, and also we use a mixed effect linear regression to evaluate the effect of the 3 arms. The survival analysis was done to compare the survival rate between aerobic exercise and control group. And the Cox proportional hazard regression was used to evaluate the effect. Well, as far as the result goes, we screened more than 24,000 patients. And at the end, we randomized 226 patients into 3 arms. So the study was conducted between December 2018 to September 2021. As you can see from the slide, that both Tai Chi and aerobic exercise can improve the subjective sleep quality, the fatigue, anxiety, and depression. But for the Tai Chi, they have this more significant effect on sleep quality. So that means Tai Chi outperform aerobic exercise on subjective sleep quality. And there is no effect in quality of life. For the 6-minute walking test, that is a measure of fitness level. And both Tai Chi and aerobic exercise have significant effects. A physiological test, we can see that both Tai Chi and aerobic exercise are significant on time up and go test, which is an agility measure, and also sit to stand, that is a strength measure. And for Tai Chi, it's more effective on one leg balance, that is a measure of balance. For the cortisol diurnal slope, you can see that both Tai Chi and aerobic exercise improve the circadian rhythm. Well, the last result is regarding survival rate, and it's very interesting to know that Tai Chi has a significant effect on improving the survival as compared to aerobic exercise and control group. Well, in conclusion, that this evidence-based study by far is the largest scale and the first 3-arm RCT to investigate and compare the effects of aerobic exercise and Tai Chi on sleep quality and other health outcome measures in patients with advanced lung cancer. And notably, Tai Chi group shows significantly greater improvement in sleep than aerobic exercise, and also Tai Chi has better survival outcome than aerobic exercise in control group. So we would recommend that because of the feasibility, safety, and acceptability of Tai Chi and aerobic exercise intervention programs in advanced lung cancer patients, we would urge the need to incorporate these two promising interventions into the regular care, and especially to improve the well-being of lung cancer patients and especially their sleep quality. Well, I think the most rewarding part of this study is not being having a paper published in JAMA Oncology. The paper was just accepted to be published in JAMA Oncology. I think that is not the most rewarding part, but the most rewarding part is after the end of the program, you can see the patient will transform from a weak, hopeless face from an energetic and hopeful great smiles on their face. So I think that is the most rewarding of running this very, very challenging trial. And also the note we received from the patients telling us that how grateful they are to be able to complete this training and also to have us with their side when they are experiencing the most difficult moment in their life. So they are truly grateful to have this opportunity to join this intervention and to be part of this study. So I have no conflict of interest to disclose. This was taken in 2015 when I first was invited to this conference, and that's my first time to meet Professor Datate. No matter he is no longer with us, but his shy smiles, his kindness, his sincerity, his dedication always live in our heart. So my talk is in memory of Professor Datate. Thank you very much for inviting me back here at this very meaningful occasion. Thank you so much.